Hello, this is Joe Trahan, welcoming you to the All Me podcast from the Taylor Hooten Foundation, whose mission is to enlighten the world to the truths about appearance and performance-enhancing substances. As the national leader on this subject, they communicate their educational messages through various methods, including this podcast. Thank you for listening and enjoy the show.
Welcome back to the All Me podcast. This is Don Hooten Jr., and today I'll be your host. We've told you that we're going to find the nation's leading experts to interview so that we can continue to impact lives and help people. You have already heard from many experts and doctors in previous episodes, and today we're going to be visiting with Dr. Tom O'Connor, the Anabolic Doc. It's important to us to give our listeners as much information on the topic of appearance and performance-enhancing substances as we can. This is going to be a multiple-part interview, so you'll need to be sure that you hit subscribe so you don't miss an episode, as the content in this interview is going to be invaluable. Dr. Thomas O'Connor is the only Board Certified Internist in the United States who focuses his practice on the care of men and women who have used or are using anabolic steroids. He is the first American physician to address steroid use head-on and offers his expert medical services for those who are concerned about how anabolic steroids can and may have adversely affected their health. Dr. O'Connor understands why people use anabolic steroids, and since 2005 have helped thousands of people retain their health. His patients include anyone who is using or has used anabolic steroids, prohormones, or other anabolic androgenic agents, including SARMS, anti-estrogens, fertility medications of various types, HGH, IGF, peptides, clenbuterol, insulin, thyroid preparations, diuretics, amphetamines, and other medical agents, and is concerned for their health. While Dr. O'Connor has cared for professional and amateur athletes in the bodybuilding, powerlifting, strongman, and CrossFit world, he spends most of his time helping regular people who have used these agents for personal reasons. Dr. O'Connor stresses that these substances are harmful and their use for bodybuilding and similar purpose is completely illegal. The content in this podcast represents the opinion and knowledge of our guests. This podcast is not to be used in any legal capacity whatsoever, including, but not limited to, establishing standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding to the accuracy of any statements or opinions made on the podcast. The content should not be taken as medical advice and is for information purposes only. Should you have any medical questions, please consult your healthcare professional. Let's get to part one of our interview with the Anabolic Doc. Welcome to the podcast, Dr. O'Connor.
Thank you so much, Don. Very excited for today.
All right, me too. And I've got so many things I want to talk with you about today. But before we dive in, let's learn more about you. Tell us about where you grew up.
Let's see. Grew up initially in New York City, Westchester County, from Manhattan. And I was one of the Metro North kids, right? So parents got divorced, unfortunately, and Dad was in Manhattan. Mom was in just north, which is Westchester County, suburb of New York City. And that was my life.
So were you an athlete? Did you play sports?
So no, I wasn't. And my dad was a football player at UVA, University of Virginia. Okay. And I was unfortunately kind of disconnected from him, you know, for obvious reasons that happen in America, right, with divorces. Yeah. In the night, I'm 55, so that was the 70s. And I was kind of a lost guy, but during my teenage years, you know, funny enough, we had smoking areas in high schools, Don. Smoking areas.
Inside the schools?
And outside,
okay, outside.
Yes. No, listen, on the school property in the 70s in New York in high schools, there was a designated smoking area on
wow.
So freaky. So I smoked cigarettes. I was kind of a lost guy from 13 to 15. And, you know, was a regular kind of kick around guy, not a bad guy. And I started at 13, I got my, this is right out of the books, you know, I got my Joe Weider weight set and some next door neighbor buddy. We started lifting, and then my, you know, 13, right? I started becoming a man, 13, 14, 15.
Yeah.
And I started growing muscle naturally, and I was lifting and I was hooked. You know, I loved it. And then at 15, I quit smoking cigarettes and I joined the wrestling team.
Okay.
And I did pretty good in wrestling, but because I think I didn't really have the coaching and I didn't have those mat skills and those neurologic skills that the really incredible guys get because they start at 7, with their dads. I missed it, but I went on wrestling. I wrestled at college at a Division III school upstate New York. I wrestled pretty well, and then I went to Syracuse University, transferred to Syracuse, Division I wrestling. That was before they got rid of a lot of the wrestling programs currently. You probably know in the 90s and in the last 15 years, they because of that, I forgot what code that is. There's a law where they have to have equal amount of female sports, which is great because I have a daughter, but they had to get rid of some of the sports that really didn't make, the role. And they got wrestling, as people know, Division I wrestling, Iowa, I'm sure still exists, but Syracuse lost their program and a lot of places lost their programs. I wrestled in college for a couple of years. I was never that good. And it really bothered me. Because I wanted to be All-American. I pushed hard and I dropped out of wrestling in my sophomore, junior year of college. And I went full blown into powerlifting.
Okay.
And I had some of the body dysmorphia. And I did some steroids. I tried these just to get just being, I just wanted to be as big as strong as I could because what that did for me, me as a young man, it was so relevant. That's why we have to be in touch with this.
I completely agree. In fact, we just released an episode with Brian Cuban, Mark Cuban's younger brother, talking about his battle with body dysmorphia and what led him to use anabolic steroids. So it's good you point that out because it's not just football and it's not just baseball. It's not just athletes. It's people that are looking to change their physical appearance. So as a young man, did you always want to become a medical doctor? Is that something you had thought about?
No. So, because I was a kick around guy, I really didn't have direction. My mom's my mom's a doctor. She's a PhD. She's a social worker. She was always educating and taking good care of us. And we were good guys. We're white guys from middle class America in Westchester. Yeah. So we had this kind of protected life, but we're kick around guys. So I didn't know what to do. And so I never had any real direction from any organized sports. So that's what we're looking at, from certainly back in the 70s, 80s, 90s, even now, it's all the guys. So you get such a great high from being, you walk in the gym, you're a man. And it's similar for women. But as far as, the men that do steroids and SARMs and all these performance enhancing drugs that is just, this is my whole life now. It's our life, me and you. So they go in the gym. It's a regular guy who's not going to get drug tested. He ain't doing it for MLB. He's not. He just, and those MLB guys. You don't become an MLB player because you're on gear. Because you're incredible. Then of course the top guys. Correct. You and I both know that, and we have to educate people on who really uses it. So by the such a huge majority, 99.999% of anabolic steroid and PED and SARMs users, they're regular kick around guys that just want to make it big and strong, and they get hooked because when they're on it, it's a dopaminergic high. It's incredible. What man doesn't want to be big and strong and bad and sexual? I mean, so that was it. So I did that. I just lifted more, and I was very limited with my use, I'll be honest. And it's kind of it's a lying man's club. I remember back in the 70s and 80s, like, oh, I'm such a little guy. I'm so nothing. This guy says he's not on steroids. This is the 1980s. Yeah. And I'm like, oh, but it was a lying man's drug. I was like, wait a minute. Then I got into some of the crews, and this is at Syracuse, right? The off-campus training. Some of the bad, I'm the Anabolic Doc, and I've been doing this, really since then. And I wanted to be a doctor in my late 20s. I have a degree in architecture. I'm kind of ADD guy. Mm-hmm. I have an architecture degree from Syracuse University. I have a graduate degree in exercise physiology. I was in a PhD program for cardiovascular physiology to be a scientist. Mm-hmm. And I was working on, literally, I was lifting, nothing else mattered. Anything I can do. I was like, this is pretty, my mom was cool. I got enough grant money to stay in school because I was smart enough, right? And I was a PhD candidate, and I was biochemistry doing my classes, and I was lifting. School and lifting go hand in hand. So I was cruise. I was feeling great, And then I was working with live dogs, and I was really doing cardiac research, PhD stuff. And I was working with live animals, and I was really, it was amazing how the things in life, kind of affect your life. If you're not ready for it. I was working with live dogs, and I was working on running them into heart failure, and we were opening up the hearts and looking for running dogs on treadmills into death to see how their hearts would. It was sad. I didn't like that, and I said, I don't want to be a PhD. I want to be a real doctor.
Yeah.
So by 30 years old, I went back pre-med. I went all the way back to Syracuse from downstate, and I went pre-med, post-bac, pre-med to Syracuse. I was 30 years old. It was 1994, wow. And then I didn't want Anabolic Doc and steroids. I had a dual life. By day, I was a medical student, and then I became a pre-med med student. Got into med school. I took studying like I did lifting, hard, very very extreme, very hard. And this is great stuff, right?
Yeah.
Athletes, NFL. You look at the best coaches in the world and drive hard, push. What a fine line that is when it comes into PEDs.
It is.
So I was one of the top students. I'm very blessed that I have a photographic memory, at least back then. I'm 55. Don't really have that anymore.
I was never blessed with that.
Yeah. So, but whatever my shortcomings were, I learned. You lift through them. You train through them. And it's a motivational speech right out of the films. And I did it. And I did use PEDs on and off, but I was very, very leery because I was just inherently I'm like a kind of a hypochondriac, Yeah. So I went to med school, kind of, it's called medical school syndrome, where you think you have all these medical conditions you're learning about. And as I was going through med school, then residency training back here in New York, and then I ended up at University of Connecticut School of Medicine, where I'm still on staff, and I'm a mentor in the primary care program for some of the med students. And I had a dual life. By day, I was, one of the top med students and resident physicians. And by night, I was a muscle dragging yard ape. I had a dual life, and I was using some PEDs, very limited, from the hair, from losing my hair. I was so worried, in my testicles and my heart health. And then it happened when I was 2003. When I was in the emergency room on call in internal medicine residency at Hartford, Connecticut, in one of our huge inner city hospitals, like a New York hospital, huge level 1 trauma. And I was up in the call room, and I got a call from my guys, my co-residents, and they said, Doc, you got Tom. We don't say Doc, we're friends, right? Tom, come down. We got your guy. Your buddy's down here. He's an Afib, and he's a steroid user, and he's in trouble, and we don't know what to do with him. And this is the back of my book, right? This is how I wrote the book, America on Steroids, Time to Heal. And I knew this is when I became the Anabolic Doc. I was like, guys, you take care of him. Is it a friend of mine? Wow. So these doctors, and now I'm not going to show off too much. I know you're in Texas. I'm in Connecticut, right? So between New York, I'll be a little bit funny. Between New York, Connecticut, and Boston, we got a couple of smart doctors.
Couple really good schools,
We got Yale, right? We got Harvard. Okay. And I'm not going to show off the big H's, right? The big Y, the big H. So I'm up here in Connecticut. It's 3 a.m. I got a 37-year-old guy in front of me, massive, 5'7", 260.
Oh, wow.
He's pro bodybuilder. He's an Afib. You know what Afib is?
No. And if you could explain that to the listeners that don't understand what Afib means.
So real quick, this is a young guy. So it's an arrhythmia, and he had palpitations and he had chest pain. So atrial fibrillation is a very, very common arrhythmia that can be dangerous, and it's more common for older people, if you will. The history of hypertension and so on and so forth. And you need to be on old-fashioned stuff like Coumadin and beta blockers, and you got to see a cardiologist, and your heart, the top part of the heart is moving. Fibrillating very fast, and it's usually not connected completely to the bottom of the ventricles, so the heart rate usually is controlled, but you're going to feel palpitations. Yeah. You're going to be dizzy. You're going to feel chest pain potentially. It's not angina chest pain, but it's, again, this is atrial fibrillation. So here's a 37-year-old guy. We see young people with AFib, but it's pretty rare. Young people are what? They're healthy. Okay.
Yeah.
So here's a guy that is in the ER, 37 years old, absolute, just if you see a professional bodybuilder, you ever see one of those guys up front?
Oh,
people?
yeah.
You ever see
Yes.
those on the streets?
Massive.
Now, correct. So this is just muscle. It's amazing the history of Schwarzenegger's time. Schwarzenegger wouldn't win a state show.
Yeah.
He wouldn't have won because the muscle levels, because of the drugs, and I will go right into that.
Yeah.
So there's this guy, and he's terrified. His girlfriend next to him is full tears because they're now this is serious medical. What's going on? So they call me down because they were intimidated by the. Can you imagine doctors? They're not intimidated by heroin users and drugs. This is the ER.
Yeah.
Not intimidated by COVID. God bless these guys in there,
Oh, wow.
So they're in there, and here's this guy, and they call me up in my call room. We used to work 30-hour shifts back then. I'm not kidding, right? I think my personal record was like 30. What's how we used to roll, man.
Yeah.
So that's how medicine used to be, and medicine is what it is. But the danger was driving home after working 36 hours. You're bouncing off the guardrails because you can't keep your eyes open.
Exactly.
So they had to change that. But you know what though? Nothing more hardcore to learn. And then you leave and you talk to the chief in the morning, and the chief says, "You know nothing. Go home." It's anything in life, Don, that's top end and hardcore is going to be, you're going to get what you pay for, right?
Yeah.
So I'm in the ER with guys, and I'll go, guys, I'm coming down. I'm trying to get a little shut eye for maybe 20 minutes. Pagers are going off. This is how it is when you're a resident.
Yeah.
So I go downstairs. I pull the curtain. There he is. I've never seen him. He's not a friend of mine. They say he's a friend of mine because they know my buddies, my residents, my co-resident physicians. They know that I'm a bodybuilder. I'm a big dude. I'm one of these guys. I look like him. So it's a buddy. I go, "Hey, how you doing?" I didn't know the guy from Adam. He grabbed my hand and wouldn't let me go.
Wow. So, we're going to dive into, a lot of the heart disease and issues with the heart and that sort of thing here later on. But what I want to talk about, is today you're the physician in chief at your practice, Testosteronology. Can you tell us what drove you to start this highly specialized business? So from that night, I became the Anabolic Doc. The next morning, it's called Morning Report. This is where the next morning, the team that's been on overnight meets with the guys coming in, all the attending, the older physicians, pharmacy students, residents, medical students, and you have in Hartford, Connecticut, and in Texas, and Dallas, and Houston, and these you have huge oratoriums, and you present. We do presentations all the time. So we present cases that are cool that came in overnight. Everyone's going to do the 78-year-old lady with the pneumonia and the DVT and the MI, and we do those because we're doctors. That's how we learn. So I told the chief, and these are my guys were great, So I said, "Chief, I got a cool case. I got this steroid user who came in Afib, and he goes, 'Oh my God, Tom, present that case.'" So I present the case in front of about 100 doctors and medical students, right, and everyone, pharmacy students and nurse students, and I looked around the room, and no one, remember where I am, Connecticut, smart people, Boston, New York. They're all from Boston and New York, all the programs. And everyone knows everything. These are walking textbook people. I mean, literally. Okay. And I'm going, does anyone know what this man was on? A lot of testosterone, decadrobolin, anadrol, and winstrol, just blanks. Wow.
You guys don't know what this is? Really? And then after the presentation, when I blew everyone away, we got him out of it. We broke the Afib, and we did a big cardiac workup on him, and he was okay, but he popped into Afib. He also took a lot of Viagra and about 3 Red Bulls. Oh, wow. So steroids, it's an amazing case. And we don't know now. So now I'm one of the leading experts in the world on anabolic steroid medical related issues. So that night, I presented my case, and I went to, I wanted to be a cardiologist. I just wanted to be a cardiologist. Remember, I was on a PhD research, cardiology. I didn't want to run the dogs into the ground anymore because I love dogs. And I understand we need to do some animal research, but that broke my heart. So I want to be a doctor. I'm going to be a cardiologist. And I'm here. I am. I'm like a second-year resident. I'm going to go on for another 4 or 5 years. I have to do a fellowship in cardiology. I want interventional cardiology. I got a lot more years ahead of me. And so that day I talked to my mentors, these older doctors, and they said, Tom, even the endocrinology guys, they said, Tom, you seem to be, this is a knack. This is like, this is what is so driven. So I was like, yeah. So I became the Anabolic Doc, but I kept it to myself, got through residency training, and I opened up. I didn't want to do cardiology anymore because I realized cardiologists, they see people with heart disease already. I want to prevent heart disease. So I became a GP. I got out, Board Certified Internal Medicine, and I opened up my own private practice in West Hartford, Connecticut. And I did I opened up a concierge. You know what concierge medicine is, Don? A retainer-based practice?
I don't, but if you can explain it, that would be great.
So I opened up, so in 2005, I graduated from the University of Connecticut School of Medicine's residency training in categorical internal medicine. I didn't want to specialize. Most of my colleagues become cardiologists, pulmonologists, endocrinologists, gastroenterologists, right? These are medicine guys.
Yeah.
I got off the boat. I did my boards, so I'm board certified. Now I'm double board certified, American Board of Internal Medicine, which is very important to me to maintain that status. And I teach in the program. And I said, I want to be an internist. I want to do house calls. I want to take care of my patients. I want to admit them to the hospital myself. I want to be an old-fashioned doctor.
Yeah.
So that was this is 2005. So this was on the way out. Even then, there was a polarity, between good doctors that didn't have the time to be in the office and then, go to the hospital and round on their patients. Mm-hmm. And any doctors that are listening right now, they know this history. So, and we're going to leave the politics out, because there's a lot of forces in our country, a lot of forces, that,
yeah.
Money, economics, insurance. I mean, now we got this thing, COVID. So I opened a practice called concierge, retainer based, and you pay a little retainer, like $2,000 a year or so, and you get a doctor like me could take a very small number of people because I take insurance. Insurance pays $75.
Yeah.
You got to see how many people, Don, do the math. Okay.
A lot of people.
Correct. 40 people a day. I ain't seeing 40 people. I'm a talker. I want to heal my people.
Yeah.
So I wanted to do it. So I did house. It worked. It worked. Who came to me me and my buddy, we opened up right out of residency. And when people would come in, how long you been a doctor? I'd look over them. 2 weeks. 2 weeks. I was a good resident though for 3 years. And I was like, so we opened the practice. Who came? Little old ladies, man. I was really a geriatric guy in the beginning. So I did house calls for my sweethearts, and a lot of crumb cakes and a lot of teas, house calls, and I directly to admitting to the hospital, and I kept teaching them. And I did it. Now within the first year, who came to me? A 37-year-old policeman on a lot of steroids, worrying about his health and losing his job. He came to me and he called the office up because he knew me from the gyms. And remember, at night, I was
working out. Yeah.
But I was a monster, man. Monster. 405 for 20 reps in the I'm a strong guy. I benched over. I ended up benching legitimately 505 pounds at 198 on the bench.
That's crazy.
Yeah. That's my video. You see my video. And I did. And I'm a strong, I tell people I'm a half Irish Jew from New York City. So there's pretty good genetics for the thinking and power. This is Russian. I got some Russian in me. So in the end of the day, I had my nighttime life in the gym. Some guys saw me, they knew me, and he came to the office. And my office staff, again, we're taking sweet elderly ladies. I'm looking for the muscle. I didn't want the muscle guys. I didn't want them. I keep staying away from you guys. This is my day job. Yeah. So the guy comes in one day and he goes, I want to be a patient of Dr. O'Connor. And they said, well, do you know this is a retainer-based practice, sir? You got to pay $2,000 a year. And he says, I'm writing the check right now. Wow. So I see him for my history and physical. He's still a patient today. I've taken 5,000. I've done over 5,000 history and physicals since 2005. So That man came in, Don. He's on steroids. He is a professional. He's not a Major League Baseball player. He's concerned for his health. He's concerned for his job.
Mm-hmm.
Okay. So he's not alone. Now we look at it. I took him in. I did a history and physical. I said, sir, I don't know what to do with you. You've been on androgens, steroids for 10 years or so. And we have to get you off. And I have to see what we didn't know about anabolic steroid induced hypogonadism. Dissect the word anabolic steroid induced hypogonadism. Now it's a legitimate term. So I told him to stop everything. Let's see how low you go. And I'll prescribe testosterone to recover you. Remember, we didn't know about this back then.
Yeah.
So 2 weeks later, a month later, whatever it was, before I was going to send him to the lab, I said, go to the labs, get off. I hope you feel okay. If you don't, I guess go to the ER or come back to me. And we got to get you off, buddy. Stop it. Just stop everything. There's no weaning, post-psychotherapy. I said, I'm not going to, you got to get you off. Okay, doc, I trust you. He trusts me. He calls up 6 weeks later. I lost track of him because we're busy, and he was, my nurses are going to make sure he does his labs. He's in a psychotic break. He's driving around. He has a canine. He has a canine, and this is a true story. I'm not saying the name. I won't say what town. I won't say what's somewhere in Connecticut, Northeast. So he's having a psychotic break. He's massively depressed. Psychotic break. He's crying. On the phone, they said, doctor, we got an emergency call. This patient of yours from 6 weeks ago is on the phone. He needs to talk to you. It's emergency. Oh, put him on. So I'm with a patient, probably an elderly lady. I said, hold on, man. Let me get the phone. So he's crying, yelling, screaming. He's on the car. We had cell phones back then, right? We had those flip phones.
Oh yeah.
And he's a canine cop. He goes, I'm killing myself.
Oh, man.
I'm going to kill myself.
Yeah.
I just don't want this dog to be alone. So I said, listen to me. Come in right now. We'll get you a shot. He goes, doc, I feel like a girl. I feel horrible. So I said, we got to give you a shot. I'm thinking, I don't want to lose my license. I don't know what to do. Endocrinology doctors he's seen, they said the same thing to him. Stop everything, go away.
Yeah.
So again, I'm not putting down doctors. I'm the anabolic doc.
Yeah.
Bought and paid for, sir. So I said, he goes, doc, you want those labs? I'm going for those labs. Guess what his testosterone was the next morning after being off steroids? It was about 2 months. 7.0. I have the chart records to prove it. 7.
And normally, where would a 37-year-old's testosterone that's healthy, that's not using steroids be? Okay.
600, 400, 600, 700. So this is, he came back to me humbly. The dog was okay. He didn't hurt. I started testosterone on him to recover him. Now I've seen, now I'm the leader and I'm teaching doctors. Steroids destroy people. They build you up and they break you down. They'll shut your testicles off. They can cause massive depression, worsen depression, heart disease, kidney disease. Don, you see my work. I'm very busy.
And you know that on the same token, we've gotten those phone calls before. We've received emails about it, and a lot of people, they have no idea where to turn to get help because they're turned away at their current doctor. They go into the emergency room. Just stop the steroids. Now, I mean, why do you think just your average Joe guy out there? We're talking just a police officer, guy you would just run into while you're grabbing coffee. Why do these people feel the need to use these anabolic steroids? I mean, we get it for an athlete, right? But why?
Don, it's a high. We're people. We're driven to feel good. It's a feel good thing. It's a limbic thing. Yeah. These are androgens. They're anabolic androgenic steroids from the 1930s to the 60s. There's about 50 of them. I do a whole category of reviewing them scientifically and clinically on my Anabolic Doc YouTube channel, right? Anadrol, D-ball, test. Now we have SARMS. It's so complicated. It's exploded because of social media and because there's a need. People think young men are young and healthy. So they think, I just do a little bit of this stuff and I'll be fine. I'm young. They're freight trades.
Yeah.
So the dangerous, the most insidious piece, or the reason why it's so dangerous, because when it looks so, everyone's lemmings into the sea. Everyone's doing it. It's a very slippery slope. You do a little bit, you get a great result. You otherwise feel great. So who cares? I mean, I'll just keep doing it. There's post-cycle therapy. And then the interesting piece is why I had to take hold of this like a bull. I had to grab those bull's horns is because my colleague physicians that I respect outright, they're endocrinology and urologist and family medicine, primary care, and the ER guys are ER guys. It's inappropriate for them. Don't let I love to protect them. And when people complain about the ER, hey, sir, hey, ma'am, don't let the ER fool you. It's a emergency room.
Exactly.
Forget the 5-star rating. Look at these people now. But I've been around this stuff for 20 years. So it's like primary care is a different thing. That's coffee medicine. Let's sit down. Let's talk about it. Depression. I'm a primary care doctor. You have to take care of come on. These men get involved with this, not to mention women. I only take care of men because women, you're a man. Listen to your voice. Yeah. You came into the world on testosterone. So I have to understand on how to write you. And if you need testosterone, I have to be very careful and provide it. Now we have data about how to recover men. This is all over from Cleveland Clinic to Baylor to Harvard. We have data experts working. They're more white collar guys, right? I'm in the streets. I'm a clinical doctor, and they're coming out there. And this is not. And look at testosterone clinics that should be in jail. They should all. But they're providing a need because traditional medicine. I'm a traditional medicine guy. But will not deal with this because Don, it's too complex. Yeah. We don't know. Now we know, but it's rigorous. It's complicated. It affects depression. We have men do steroids. They come off. I get 3 to 5 consults per day. Men come off steroids. They're on steroids, SARMS. They cross a line where they shut down their own production. Yeah. And not to mention heart disease, psychiatric disease, gynecomastia, acne, erectile dysfunction. I mean, you can see my videos go to head to toe, hair loss. So, these drugs are powerful. Their variability is incredible, like anything else, because there's 150 different drugs. And then guys use all sorts of permutation combinations, and they're getting the advice from the internet. This is what we're seeing in our research. Internet, because of it's all online. And then it's called bro science. Yeah, bro. And doctors are not involved. And none of these, I've seen my share of MLB guys. No names mentioned, no teams mentioned. I have X and NHL, NFL, MLB. I got Olympic guys. I'm the Anabolic Doc. So I used to write in the magazines. We don't have magazines. Magazines are dead. Magazines, it's all online now. When you were in LAX, so when famous guys used to come to me, they would be in LAX airport and they would pick up muscular development or muscle and fitness. And I was in there and they were like, I want to go see the Anabolic Doc. This is cool. And they, now people realize, oh, the Anabolic Doc, I'm an expert in anabolic steroids. I don't support them, but I'm very careful. I love the guys that use them because I was one of them. Yeah. Who's going to hate? Who's going to hate? Who doesn't want to be big, strong, bad and have great sex? Yeah. And these drugs, they'll do that when you're on them, maybe. It's complicated. Yeah. Psychological, depression, anxiety, stress. I do this 24/7. I'm pretty charged up because I created this. I discovered this world.
Yeah. And, one of the very similar stories obviously hit home with me was when my brother was using anabolic steroids and he was experiencing, at the time, 16 years old, many of the textbook side effects of anabolic steroids. So my parents took him to a couple of different doctors. None of them actually talked to him about steroid use.
Well, they don't know.
Yeah, they didn't know how to help him. When my parents asked for a drug test, they just gave him the standard street drug test. So obviously, when the test came back that he was clean from street drugs because he wasn't tested for anabolic steroids, he told my parents, well, look, I told you guys I'm not using drugs. And that's the mindset of a lot of these kids.
But
It was one of the doctors that it was actually a psychiatrist that he was visiting with, and basically told him to quit cold turkey in the middle of his cycle.
Wow.
So I guess my question for you, and I'm not sure if you're able to answer this, but one, was it bad advice? And if so, what is the proper way to treat a patient who wants to quit anabolic steroid use? Is there a best practice?
I'm never here to throw doctors under the bus.
Yeah.
Retrospective, it's Monday morning quarterbacking, right? Monday morning quarterbacking. So at that time, he didn't know. Mm-hmm. He didn't know. So it was deadly advice. It was deadly. I've been through multiple suicides. Multiple. Yeah. And even with guys that I've been cautious with to say, hey, brother, let's work with psychiatry doctors and try to wean you off. So we wean. We don't do that anymore. We would wean. But Don, it's case by case. Yeah. You need to have a very good doctor. The doctor needs to be trained in anabolic recovery medicine. I'm doing it. Yeah. And there's a couple of us, but there's a handful. Bashane and Lipschultz. And Lipschultz, I think, is crossing the dark line. He's going into anti-aging. He's working with some dirty anti-aging places. And again, I tell the truth, Don. I work for my patients. I don't work for organizations, and this is my interview. So thank you. So, the academic research is moving fast. We're doing it. Other docs are doing it, but it's stuck in the White Tower. It's stuck in those academic towers. So, but we're teaching, and so many doctors in the streets, from ER doctors. I get referrals from ER doctors, 24/7, primary care, cardiology doctors. You know how many guys come to me when a guy is in recovering from a stent or a bypass surgery, and the doctor. I have so many. I'm smiling because so many of my friends are cardiology doctors all around the world, and they follow me. And maybe some of them have done steroids, or they're certainly big and strong. And these are doctors that are younger now, and they're like 30s and 40s. And even younger, and they're fans of my YouTube channel, and they put a stent in a guy, and they go, "Hey, here's a card." No one has cards anymore, right? He goes, "Do you know the Anabolic Doc?" And I'm humble to say, but it's kind of funny. Most guys go, "Yeah, I know the Anabolic Doc. I follow his stuff, and I read his." And he goes, "You have to go see him." So a guy from Cincinnati, from LA, from Chicago, from Florida, he'll come see me, and he'll say, my cardiologist put the stents in and said, the old day doctors were just son of a bitches. Stop the drugs and you're horrible. I teach these doctors, be nice. Don't be aggressive, because if you're a healer, where's the aggression coming from? Don't do it. We're not aggressive to heroin users. We're not aggressive to obese people. We're not aggressive to cigarette smokers, alcoholics. So this is a drug. It affects the central nervous system. There's absolute withdrawal syndrome. We have data. There's a evidence-based data to how to take care of them. I do it. And there's again, this doctor didn't know. It's so sad. And obviously, Don Hooten Jr. I mean, you're the famous guy. Your whole life is in our whole life. I'm a medical expert in it. You're a political and a business and a non-for-profit expert, an educational expert. I know who you are. And here we are. I hope that people hear this. We need more resources for education to physicians. We need more community resources. We need to you're doing a great job. People need to know that millions, who knows what the number is right now. Talk to me in a few months, because we're doing some calculations. Millions upon millions upon millions upon millions of men, forget just America, are taking anabolic PEDs, androgenic SARMs. They're to themselves, Don. Yeah. Today, by the time I go off the phone, I'm going to have one or two more consults.
Looking for people to get help. But I mean, I guess the thing is, why aren't medical doctors, why isn't this something you guys are trained on, anabolic steroids being, and testosterone?
Let me tell you why. We got a lot on our plate.
Yeah.
And we got a lot on our plate, and it's changing now. It's still not even there really yet, because we're still in the beginnings of this thing. Talk to us in 20 years, in 10 years. I'm making it something relevant. And because it wasn't that big, and there's always a lot of other things to look at. Doctors are super busy. They never have enough time. And it wasn't on the radar screen, Don. So And up until about 15 years ago, I think, or because of the internet, So back in the 80s, let's talk about this. Back in the 80s, everything's multifactorial. It's never like, it's kind of slippery slope-ish. So back in the 80s and the beginning of the 90s, before the internet really took on, how did you get steroids? You had to be in the club. Yeah. You had to be in the gyms. You had to be connected. And it was amazing. I'm not giving it a blessing. I'm saying back in the 80s, you had to just go in the gym, and I guess some gyms there's always a steroid pusher that will give any kid steroids. But the gyms I was at, the hardcore, I'm talking the top powerlifters and bodybuilders of this world. This is an underworld.
Yeah.
Back in the 80s and 90s, it's not an underworld anymore.
It's done right out in the open.
Come on, man! Everyone's talking. Why? Look at YouTube. Everyone's telling the steroid cycles. Remember Rich Piana?
Oh, yeah.
And Boston Lloyd. You know who Boston Lloyd is, right?
Yeah, and I've even read a lot of the comments that just take place under some of the videos that you're putting out there.
What are you talking? Look at the comments on my video.
Yeah.
So there's a blessing and curse, sir. The world is open because of social media. There's some good things about that. There's some bad things about. I mean, this is a bigger. This could be another podcast with maybe a priest. I don't know. I mean, this is complicated. It's out there because a few things have lined up. The availability is wide open. Everyone always says, like the mother would say to me, or their next door neighbor, or someone, how do they get it? Or doctors, all these doctors call up all the time. How do they get it, Tom?
Yeah.
What do you mean, doc? They get it on the internet. Don't do that noise. Don't give me that.
Yeah.
Wake up. These are kids. 15-year-old kids are buying drugs on the internet, SARMs and steroids, and they're administering right under the nose of the mom and dad. He gets it in the mail. He gets it. I don't know. I mean, like these are not. I have a 14-year-old. These are smart kids.
Oh yeah, and they've got access to a lot of information. We actually did a podcast on just how easily obtainable these drugs are over the internet and some of our kids' favorite social media sites, including TikTok.
So let me tell you something. It's who doesn't want to look good? Now, unfortunately, our social media, look at everyone's Instagram, but everyone wants to be sexy and popular. Has that ever, that was back in the 50s.
Yeah.
I mean, so come on, we're human beings. We're attracted we're designed to be attracted to things that look good. Beautiful bodies, beautiful hair, beautiful physique. Come on, Don. Yeah. This is a multiple trillion-dollar business. This overlaps into fitness and beauty and modeling, and we need to openly discuss it. And you know what's interesting? Because I'm always working with other experts and we're doing research. I was talking to one of my researchers, a student last week, and he said, Doc, when we're looking at this bigorexia and biodysmorphia for the real serious professional guys, they don't think they have it. Because they're not clicking off. They're not clicking off of what to have anorexia or bigorexia. This is a body dysmorphia. This is going to fall under potentially like a mood disorder, right?
Exactly.
Now, I'm not a psychiatrist, but again, look, you have to click. You don't measure blood. It's not measuring blood pressure. You don't do an MRI of the head. These are questions. And if you have 5 of 7, if you have 3 of 5, so it's a criteria. So when you ask them, are you obsessed? It's all interpretation. The guy says, I'm not, it's not wrecking my life. I'm not, it's better for my life.
Yeah.
So there's interpretation. That's how, now, apart from disparaging these people, these men, that's how sick it is.
Yeah.
But now when they come to me and they can't get off steroids, you're a 23-year-old man and you've now permanently shut down your own production of testosterone. At least you've done that. I have to put on 23. The average man who comes to me, 37, and he's been on steroids for 10 years. He's dusted. He's never going to be able to produce naturally. And I say to them, my number one risk is my number one bullhorn. My number one bullhorn message is, hey, man, if you're 18, 15, 17, 20, 34, there's 55-year-old men starting steroids for the first time. Talk about a mid-age crisis on steroids.
Yeah.
So literally, and it's a book. But young guys, I say, you want to do? I talked to a guy yesterday. They consult me all the time, right? I love these guys. They trust me. He's got Anavar and Winstrol. He wants to know how to do. I go, I'm not going to yell at you yet, but I'm going to spend an hour and a half on the phone because they pay for an hour consult. I always go more. I apologize for people waiting for me in the waiting rooms. No waiting rooms, all clinical, all virtual.
Yeah.
I say, sir, I respect you. I'm the Anabolic Doc. I'm going to give you a crystal ball. You're going to do a 6-week cycle of Anavar. You think it's going to be fun? Let me try to predict what may happen. Yeah. And if at the end of the day, sir, you may feel great. You may get the body you want. You may not. Be careful for what you want, what you wish for. If you get some good results, you're going to do more. You're coming back for more.
Exactly.
And then at a certain point, sir, let me ask you a question, sir. Let me ask you a question. I respect you, sir. Let me ask you a question. If I say to you, this could lead to you being permanently on testosterone the rest of your life, and with all the side effects, with hair loss and heart disease potentially, prostate issues, I'm not going to go into all the details. Okay, is that a problem? And if so, that's the point of my discussion and my counseling and my education and my love for these guys and respect for these guys, which doctors need to learn. Don't be disparaging. No one likes the arrogant doctor that looks down the nose. Yeah. So many guys come to me and say, Doc, you are the best doctor. Why? And again, I don't need to be the best doctor. I need to be a good healer. But they say, Doc, God, my doctor was a douchebag.
Yeah.
He didn't know the stuff, and then he's embarrassing himself because he's saying things that he doesn't know, when clearly there's more data out there that he doesn't know. So, doctor, just bow out and say, thank you so much. Refer to another doctor. But there's no one to refer to. When I tell these guys, you're going to be on testosterone, I told a kid yesterday, 27-year-old man, it's a kid to me, and I said, you're going to be on testosterone. You really want to do the Anavar cycle? Do you want to be on testosterone? He's a musician, professional musician. He's doing it for a video. He's going to be on some music video. I said, sir, you don't need Anavar for that. Yeah. Come on. You're a musician. It's going to mess up your vocal cords.
Yeah, and they're looking for the quick fix.
I said, correct. It's America. It's the world, man. And there's nothing wrong. We have to accept that. It's been going on since the dawn of time. Since there's been someone out walking, and there's been the guy to sell a wheel there's been the guy who could reinvent the wheel when you're a caveman. There's going to be this stuff. All these guys are good, and the gurus and the coaches and the bull and the money and I have this. No, and you come off. We do post-cycle therapy. It doesn't work.
Yeah,
it's garbage.
Yeah.
So if you don't, it's either, I tell guys, in the end of the day, it's an on and off switch. You either do these drugs or you don't. And if you do them, you're going to be a patient of mine or one of my doctors that I'm licensing, and you're going to need recovery and you're going to have potential. So many men are so sad for what the choices they've made. And these are not Major League Baseball players.
And it all stems back to education and people being educated as to what it is they're putting in their body.
This is it, Don. Don, this is it. And I tell them, I give alternatives. So I gave him an alternative yesterday. I said, sir, so what do you want to do? Doc, in 4 months, I'm going to be in this big video on the beach. I'm going to be playing a banjo, and I need to be ripped. And I go, sir, let me look at you. I look at him. I go, sir, I'm going to be honest with you. Can I be honest? Please, Doc, be brutally honest. Sir, you're 5'7", you're 200 pounds, you're fat. Doc, I love you. Keep going, Doc. Because I'm a physician, so I don't do this with everyone, Don. But I feel the men. It's a man. I feel these. That's part of my healing. These men trust me. I listened to his history. I heard his thing. I said, sir, now I'm going to tell you the truth. You're eating. You can get it. Go get one of these coaches and just don't take the drugs from them. Get a coach. It's all diet. You're going to heal. And he said, Doc, I can't wait. You are so awesome. I said, what are you doing, Anavar? Now, hold on. So that's a pretty rare guy. Most guys, they do consults. They're like, Doc, I'm in the middle of cycles. I love steroids. Mm-hmm. Please help me so I don't enlarge my heart, have a clot, have a heart attack, lose my hair. Now, that's my work. And again, I don't give a blessing to them. But they're already full 10 years in. That's a different bear. The kid yesterday was a virgin. I said, sir, you're a virgin to me. You've never been exposed to androgens. I will do anything to prevent you from being exposed to androgens. Yeah. And we did it. And I said, if you need to call back, call back. I mean, but I'm obviously overloaded, but I'm hiring and training doctors. It's an art and science.
Yeah.
You know, the art and it's a loving, caring, healing, non-judgmental. Doesn't this sound like doctors? And we have doctors like this. You know, ER doctors in New York City and Hartford, Connecticut. I learned with IV drug using HIV positive hepatitis. I learned on these people. I saw such incredible sadness and suffering, and I look at them, and then you look at a steroid user, and I this is where I criticize physicians. Oh, he may not look like an AIDS patient to you, but he's going to suffer just like an AIDS patient. He's going to have no sex drive. He's going to destroy his fertility. He could have a heart attack. He's going to maybe commit suicide because if he has any underlying disease and depression. When you come off of steroids like your poor brother did, when you have underlying depression, you make bad decisions. You make bad decisions. And I've been through it multiple times. And you're a big player in the world, Don, because your brother had I know a lot about your brother and the case. Your brother had underlying depression. He was a teenage boy, but he had depression. People have depression. Have depression.
And, you start mixing
he
drugs
was
in.
More at risk for the severity. He was more at risk. His withdrawal off of anabolic steroids, which is the FDA has a warning on testosterone. Did you know that? The feds in 2015 put a boxed warning on testosterone. Just testosterone for any other guy walking around using just a gel because my guess is from your brother and from all the other cases we've learned since your brother's passing. If you have underlying depression and you're playing with any drugs, not to mention anabolics, and you come off them, you get dark thoughts. Yeah. Dark thoughts.
What are you doing with the knowledge and experience that you have to ensure other medical leaders around the world are being trained on this topic so that they too can help people?
I'm opening up a fellowship for physicians. Only real physicians. No one else but a physician. Yeah. I'm opening a fellowship for training.
Due to the limited time that Dr. O'Connor has in his schedule, we've had to break up this interview into multiple episodes. We will be back next week as we continue our discussion with the Anabolic Doc. Our discussion is going to take us from what he's doing in training physicians to care for those who are using anabolic steroids into what anabolic steroids and testosterone are, how they work, and why they were designed. We will also dive into the wildly popular world of TRT, testosterone replacement therapy. But most importantly, I want you to hear from Dr. O'Connor about the side effects of abusing these drugs, including the damage they could be doing to your cardiovascular system. Thank you again for tuning into the All Me podcast. We appreciate all of your support and ask that you would hit subscribe so they don't miss another episode. Please be sure to leave us some feedback and let us know how we're doing. We'd also ask that you consider making a donation to the Taylor Hooten Foundation to help support our education programs and our mission to enlighten the world to the truths about appearance and performance-enhancing substances.
Well, that's it for today's show. Thanks for listening to the All Me podcast from the Taylor Hooten Foundation, a nonprofit organization leading a national campaign to enlighten people to the truths about appearance and performance-enhancing substances and inspiring people to live and compete without the use of these substances. Please be sure to subscribe to our podcast and tune in to our next episode.